Every Friday, we talk to a personality who has lived a life of service, and today is a very special day. A few weeks ago, Ghana Health Service came out to say Ghanaians should wash their hands with running water. And a lot of us were wondering exactly how millions of households would achieve that when they don't have access to running water. Now, we have a biological scientist in this country who has spent her entire life creating and designing a product that not only saved lives in Ghana, but West Africa as a whole. So today's interview is not just any regular personality profile, but we are celebrating one of our own, talking about Veronica Bekoe. She's the woman behind the Veronica Bucket. All week long, when you go to supermarkets, shopping malls, you see these buckets with a tap at the bottom, and you're wondering, where did these buckets come from? Most of us remember seeing them in schools and hospitals, but now they are all over the country. We're so proud of her. And if you have any questions for her, let us know with the hashtag BreakfastDaily and the WhatsApp line 0550-585-832. Good morning, Veronica.
Good morning.
How are you?
I'm good.
Thank you so much for being with us.
You're welcome.
So we'll talk about the Veronica Buckets, but we want to learn about your life. What was your childhood like? Why did you decide to do science in school when you went to university?
Well, my childhood was quite interesting. I liked learning, and especially the sciences. So I knew, and my parents knew right from the beginning that I would do science, so which I pursued from secondary school right through to university. Ended up at the University of Science and Technology with a Bachelor of Science honors degree in biology.
What did you like about science?
I'm a curious person. I like to understand things. Maybe that was what motivated me to do science. I like nature too. That was why I chose biology. Okay. I know I could handle maths all right, but I didn't excel in maths. So the little maths I knew supported me to do the biology. And I like drawing nature. So I think that was what motivated me.
So once you were done with school, what was life like? What was your first job like?
My first job, I was posted to the Ministry of Health, and I was sent to Kolebu, the public health laboratory.
Okay.
And the public health laboratory then was a small laboratory. I don't know whether you know the old medical school mortuary in the corner somewhere, where all the diseases of public health interest, like the choleras, the TBs, diarrhea diseases, HIV came later, were being taken care of. So that was where I was posted.
Were you not afraid?
No, not really.
Why not? I mean,
because by nature, I'm very careful about what I do. So I wasn't afraid. I went boldly into it. And I was with the public health laboratory for over 40 years, dealing with diseases of public health interest. And in 1986, at the advent of HIV, the head of department selected about 8 of us to be trained to handle the testing for HIV. And you'll be surprised I was the only one left to handle HIV
Where did the rest of them go?
Well, fizzled out. It's a long story.
What kept you there?
I liked what I was doing. I was motivated to do what I was doing, so I enjoyed it. And, although I wasn't a trained teacher, I like teaching people the little I know. So maybe that was what kept me there.
Now, what's the story behind the Veronica Buckets?
The story behind the Veronica Bucket is that at a point, somewhere early 1990s, USAID decided to help Ghana restructure their public health laboratories. So they sent a laboratory advisor in to assess the situation on the ground. Well, it was a lady, Dr. Joan Hetrick. She passed on about 2 years ago, may she rest in peace. When she came, she realized that, like I said, it was only that small structure in the corner that represented public health laboratory in the whole of Ghana.
Not just Akua?
No, Ghana.
Wow.
So I think she talked to her people that they needed to do something. So initially she wasn't supposed to put up any structures, but she managed to get them to put up 4 public health laboratories.
Wow.
But before then, we had to do baseline assessment of all the labs. Not all, but selected labs, at least in all the regions, to find out exactly what the situation was like. And you know the story. I mean, most institutions didn't have running water. We restricted ourselves to the labs, and you had no idea what people were doing with hand washing. People either neglected it totally, people were using bowls of water in the laboratory.
Where the water would just be in the bowl.
People were using maybe a bucket and a cup to fetch the water. So you can imagine what we exposed ourselves into. I can say that it was a divine intervention. When the lady came, she decided we had to do some training. After the baseline assessment, we had to do some training. And that included infection prevention. So she gave me the responsibility of taking that on, to go around the country with her to teach infection prevention. So, as we were going around, it just clicked. And like I said, it was a divine intervention. Then the women had started using the aluminum container to sell porridge. So I said, wow, if you fit a tap to this container, it can provide running water. Because during the research for me to be able to handle the training, I realized that proper hand washing was the most important form of infection prevention. So I sold the idea to her, and she said, yes, it's true. If you wash your hands well, no matter what you touch, you are almost 100% safe. So she bought into it, and I made I had a prototype made with the aluminum container and a tap fitted. Okay. So as we went around the regions, that was what I used to provide running water for people to wash hands. So in actual fact, it was the laboratory, which all the laboratories in Ghana, we started using this
because
type
they
of
lacked
container.
Access to running water.
And that was our objective, to provide running water for safe hand washing in the laboratories.
And what were some of the reactions you got from the people within the laboratory?
Oh, they were very happy. They were very happy because we made it obvious to them that they were exposing themselves to a lot of infection, especially those of us who were dealing with infectious diseases. So, it caught on. Okay. And almost everywhere. Well, in laboratory training, we don't only restrict ourselves to the lab personnel, especially with HIV. There were nurses, secretaries, anybody, who helped in the fight for HIV. So eventually, the hospitals and the clinics realized that they would also need these buckets. So that was how it caught on to the institutions, the hospitals and the clinics. And you know what is happening now. It's even in restaurants, homes, supermarkets, all over. So that is the story of Veronica Bucket.
How did this, now we're looking at it as a very simple, efficient invention, contribute to reducing cholera cases and other things, diseases that we were dealing with and didn't know how to solve the problem?
Yes, like I mentioned earlier, hand washing is the single most effective form of infection prevention if you do it and do it properly. And in hand washing, it's interesting how people wash their hands. Apart from the time spent, some people just wash their fingertips. Yeah. So we had to go in to teach how to wash your hands. If you wash your hands, whatever you have on your hands, 99.9% of them are cleared. Yeah. Seriously. And you have to do it frequently. You see,
go ahead.
That's coupled with maybe wearing gloves and other things. But maybe if as we go along, we'll talk about the gloving.
Oh, please go ahead.
Okay. Yes, it's okay to wear gloves. But sometimes I see it as a false security in that some people don't use the gloves properly. And they don't change them often enough.
So a lot of people are walking around now with gloves the whole day.
Things,
is there anything wrong with that?
There's everything wrong with that because they are wearing this pair of gloves, touching everything and everybody. And sometimes you see that the gloves are even wet. Once you have wet gloves on your hands, anything can seep through. So it's false security. Wear the gloves if you have to. There are situations where you have to wear gloves. But for goodness sake, change them frequently. And if you are not using them properly, it's better. Get rid of the gloves and wash your hands frequently with soap and running water. Formerly, like I said, people were just using bowls. At best, you can see 2 bowls, one for the washing and one for
getting the soap out.
But remember, it's only safe for only the very first person who washes their hands. All the other people are taking whatever is in the water on their hands.
How difficult was it to change people's mindset about only washing their hands when they see something dirty on their hands, or even only washing their hands after they are done eating?
Well, those of us in the lab, we know that there are things you cannot see with a naked eye. So it was okay. But I think with time, people really appreciated that they needed to wash their hands. With some of us, you see, after a period, you just feel like washing your hands. Maybe it's the mindset, the sort of things you have been handling. So gradually, with training, although I can't say that we succeeded 100%, with training and a lot of talking, people bought into it and they accepted that they needed to wash their hands frequently and with running water. Not just washing hands, running water, and to spend a little time doing it and doing it properly.
Okay, now it's Women's Month. We've been talking a lot about STEM education for young girls. And when we talk about STEM in general in the world, there's this school of thought that Africa is just a recipient. We take what has been invented or innovated elsewhere. We don't necessarily contribute to the invention. Now, something like the Veronica Bucket, someone in the developed world won't think of it because they don't have the running water issue. How important is it for young people, not just scientists, to begin looking at our problems critically and thinking of locally grown solutions for those problems?
We have to think through what we have and really find ways and means of helping. I said, what motivated me to come up with this was what I saw in the system. And I felt that we those of us in the health sector, were rather killing ourselves than taking care of the patients. So I think if you look critically at what you have and find ways and means, maybe you can improve the situation we have. We shouldn't be always content with what we have. We should be motivated to move ahead, move forward, to do something better for ourselves and wherever we find ourselves.
Now, the Vice President in particular is known for all things digital. And in our generation, when you hear of innovation, we're always thinking of applications, app on mobile phones, app here, app there. What's your definition of innovation?
Very simple, basic things you can put together to come up with something, not necessarily going digital. Like this example we have here. Before these big tanks came up for storing water, this was in existence. Yeah. I don't know whether this was what motivated people to come up with the big tanks to fix a tap to provide running water. So maybe when we look around and we look around critically, we can make use of the very basic things we have around us all the time to do something, add value to whatever we have.
What drives you?
Drives me? To help Mother Ghana and the world at large. I like helping. I like doing some things for people, something that will inspire people to move ahead, something that will make people feel better. That's my motivation. I like everybody around me to feel good. That is my motivation.
Now, you've been celebrated all over the world. The United States of America Embassy gave you the Heroes Award for Outstanding Leadership and Support for the SLMTA program. I'm sure you tell us what it is. The First Lady of Ghana recently awarded you for your work. How do you feel when people recognize the life of service that you've lived?
I'm inspired to do more, and I thank God for how far He has brought me. Because when I was active in the lab, what I kept telling people, especially those who come straight from school, I tell them, look, I was like you when I started, but with hard work, perseverance, you can get to where I am. I didn't get to my position, like it happened with a magic. I had to work hard. So I motivate people to work hard. Yeah, there was a lot of fighting. If you ask the lab
walk
people,
us through some of the challenges you faced, because everyone sees the success.
Yes.
What were some of the difficult?
Oh yes,
experiences?
I'm sure most of the lab people I worked with will say that I was a difficult person. It's
Why?
true, yes, because I always like to make people work, and I wasn't bossy. I enjoy teamwork. Whatever had to be done, I got involved. So they got motivated by that. And it was afterwards that they told me that, look, you don't know, we were fighting all the time, but we knew that you were doing something good for us. So I like teamwork. Work with people. Don't be bossy. But whatever little you know, try to spread it out so other people too can benefit from it. So when I get such awards, that it makes me feel good, but it makes me feel that, well, somebody has recognized what I'm trying to do for others. Mm-hmm. So it motivates me to move on.
What advice would you give young girls about engaging proactively with opportunities within the STEM space?
Everybody has a chance. And there are lots and lots of opportunities out there. It depends on you, the individual. Mm-hmm. You should strive to aim high. You see, don't think because you are down there or you are new, it's somebody's business. Always make it your business to contribute your quota. Work with your people. Don't think, well, nobody will notice if I'm not doing my bits. Everybody is important. In the hospitals, for example, from the laborer, from the doctor right down to the orderly, everybody is important. So we all have to play our role and play it very well.
Now, you've lived through cholera, HIV issues. Now we have coronavirus. Mm-hmm. What advice would you give us on not just passively waiting for the pandemic to take over, but being proactive the way China has been proactive to a point where they've not even recorded any local case recently? What should Ghana do?
Well, we should step up our personal hygiene. Every individual should make it a responsibility to step up our personal hygiene. We have to obey all the instructions given by the government, keep our distances. I'm sure people are angry that schools and churches have been closed, but it's for our own good. So every individual has the responsibility to play his or her part so that we'll be able to control this coronavirus. Most importantly, step up your personal hygiene. People cough openly. They don't care or mind where they are or who is around. People go about hours without washing their hands. I will advise, whenever you go out and come in, please wash your hands. Even if you use your own car, you open your door, you open your car door, you open your office door. When you get to a place where water is available, wash your hands with running water. Yes, the sanitizers are good. You can use the sanitizers when you don't have access to running water. But if you do, wash your hands and then maybe apply the sanitizer.
Okay, now for all our viewers watching who may still not have access to the original Veronica Bucket, where do we get them?
Well, this is interesting. I produce and sell, but I'm sure you've seen various versions all over.
But we want the original Veronica Bucket.
Okay, so if you contact me on my telephone number 0244 373431, I can help you out.
0244 373431. I actually like the number. It's so easy. 373431. You can get the original Veronica Bucket. And it's not only in Ghana, it's in most of West Africa.
If you Google or you go online, you can see it being used in West Africa mainly.
Wow.
In schools and hospitals, restaurants, everywhere.
And it's here to stay.
It's here to stay.
When it's all said and done, when we hear the name Veronica Bekoe, what would you want us to remember you by?
Oh, that's from my little corner.
A very big and bright corner.
I have been able to help out with something like this. Not only in Ghana, but it's gone outside helping others. And it was on Ghana Web that is being used all over. I don't know how far it has reached. So I thank God for that. Yeah, this is what I want to be remembered by.
We thank God for you and the life of service that
And by the way, I didn't name it Veronica Bucket.
It
was the lab advisor who came in to build the laboratory, a public health labs. Because I came out with the idea, she was the one who named it Veronica Bucket.
Well, we're happy she did, because it's important that we're able to trace it back to the person who made this possible. And you've saved millions of lives just by thinking of a solution to a problem that people were battling with. So in this coronavirus space where people are paranoid and scared, it's nice to see a light at the end of the tunnel. And I hope that millions of people who are watching us will be inspired that sometimes it just takes paying attention to the problem and finding locally grown solutions to it to save people. So thank you.
You're welcome. Glad to be here.
Thank you at home for joining us for the personality profile. It's really important that as we're dealing with this coronavirus, all the potential inventors and innovators out there are empowered to not just look at the problems we'll be facing, but think of innovative, simple solutions to them that are locally relevant. We're talking to Veronica Bekoe. She's the designer and creator of the Veronica Buckets. Now, you've been seeing them all over, but if you want the original Veronica Bucket, I'm going to mention the numbers again. 024, and we're looking here, 437-3431. 024-437-3421. So call 31. I almost got it. 024-437-3431. The pictures are right there, so you can call them if you are a wholesaler and you would want to supply them. This is a time actually for corporate Ghana to come out and supply every single household in our low-income communities with these buckets, because there are people watching us who may not be able to afford the Veronica buckets, right? They're affordable, actually.
Yes,
What's the price?
For this, the bucket and the bowl is 100 cedis. Okay. With a stand is 300.
Okay, so you can get everything.
Stand, yes.
Corporate Ghana, if you're watching us, this is a call to you to sponsor a household with one of these buckets so that we can all fight coronavirus together.
We hope you've enjoyed the show. Make sure you subscribe, like, comment, and share with your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.